Have you or a loved one ever suffered from chronic migraine? Well, if not, we are here to inform you what exactly it is. It is defined by having more than 15 headache days per month over a 3-month period. Chronic migraines activate the inner cell lining, leading to release of substance involved in inflammation and coagulation and decreasing the ability of vessels to fully dilate. It could be caused by saltier aged food, hormone medication, and sensory stimulation, as well as many others. Statistically, more than 70% have a family history of migraine, 7% of all migraine sufferers are women, and 63% have one or more migraine attacks monthly. Mainly affects people from the ages 35 to 55. Symptoms and signs to look out for include food cravings, constipation, frequent yawning, visual phenomena, difficulty speaking, nausea and vomiting, confusion. Its effects can prevent people from doing daily tasks. Treatment may include pain-relieving medication, prevention medication, as well as cardiovascular drugs. Cures include acupuncture, biofeedback, massage therapy, and herbs, vitamins, and minerals. To prevent chronic migraine, avoid substances such as alcohol and log activities in direct sunlight. Now onto the subject of leukemia. Leukemia is defined as cancer of the body's blood-forming tissue, including the bone marrow and the lymphatic system. It affects the body by reducing the level of white blood cells. It affects other body systems while damaging lymph nodes, which will affect the immune system. Some causes include radiation, exposure to chemicals, smoking, as well as drugs. Symptoms include fever and night sweats, feeling weak or tired, shortness in breath, discomfort and pain in abdomen, swollen or enlarged gums, unusual bleeding, petechia, bleeding and bruising, frequent infection, as well as feeling bloated. It may affect someone's daily life through mental health, emotional distress, and physically through hair loss from chemo. It may be treated through biological therapy, chemotherapy, targeted therapy, radiation therapy, as well as stem cell transplants. Most adults and children with leukemia have no known risk factors. Therefore, there is no sure way to prevent leukemia from developing. Statistically, there is an estimated of 363,794 people living with or in remission from leukemia in the U.S. 2009 to 2013, leukemia was the 5th most common cause of cancer deaths in men and the 6th most common cause in women. In 2017, 24,500 people are expected to die from leukemia, 14,300 being males and 10,200 being female. Overall relative survival rate was 62.7%. Now back to your video. Hello and welcome back. Today we'll be discussing the circulatory system of the body. The main function of the circulatory system is to carry through the blood nutrients to the cells of our body. It is formed by the heart, arteries, and veins. Major tissues include epithelial tissue, muscle tissue, nervous tissue, and connective tissue. Major cells include red blood cells, white blood cells, as well as platelets.